Dealing with diabetes comes with undesirable complications that you need to tend to inevitably, but making sure you learn about these complications helps you stay prepared for them. You can make changes in your lifestyle that will aid in reducing the intensity of these complications. So today, I, your Sugarfit health coach Venus, will be talking to you about various complications of diabetes and what you need to do about them. The list of complications of diabetes is a long one, so sit tight as we go through them one by one. Knowing what you're dealing with and its future potential can help you prepare for the worst and even limit the intensity to an extent. Let's start with the acute complications first. Number one on the list is diabetic ketoacidosis. When your body produces high amounts of ketones, it is called ketoacidosis. To break it down to you, we know that in the absence of insulin, your body cannot use glucose to produce energy. So, it starts breaking fat in its place. This process results in the buildup of ketones, which is produced when the cells don't get enough glucose, leading to ketoacidosis. The next complication that we're going to talk about is hypoglycemia. When it comes to acute diabetes, people are usually administered with medications or insulin in order to manage the blood sugar levels. If someone gets an unsupervised dosage of medications or insulin, it often causes a sudden fall in the blood sugar levels. This is called as hypoglycemia. The third complication of diabetes we are going to talk about today is frequent peeing. The excess glucose in your blood is broken down and absorbed by the kidneys in the acute diabetes symptoms. The kidneys then help excrete this glucose in the form of urine and also draws out fluids from your cells. This is what causes the urge to pee often and an increased thirst too. Now let's look at some of the chronic complications of diabetes. Neuropathy is one of them. Neuropathy is one of the many complications of diabetes that causes a lot of damage to your system. Continuous high blood sugar levels tend to destroy the nerve endings and can cause tingling and burning sensation in the lower limbs. This eventually leads to a loss of sensation starting from the tip of the toes to the fingers and to the soles of the feet, and this is called as neuropathy. The second one is kidney damage. Kidney damage is another serious complication of diabetes. It is caused due to excessive pressure on the kidneys to filter the blood. It can sometimes result in kidney failure, and such people may need to be on dialysis during the later years of their life. You'll also notice cataract and glaucoma, and even damage to the cornea due to diabetes. Even your wounds will take longer time to heal, as higher the blood sugars will slow down the recovery or sometimes even make it worse, leading to gangrene. Another complication would be having trouble sleeping undisturbed. A lot of diabetic people tend to develop the condition called as sleep apnea, which disturbs your sleep. If you're someone with type 1 diabetes and are wondering what complications are specific to your diabetes type, then don't look away, because that's exactly what I'll be talking about next. With type 1 diabetes comes the increased risk of heart and blood vessel diseases such as coronary artery disease, heart attack, atherosclerosis, and narrowing of the arteries. It also causes increased blood pressure. Neuropathy, kidney damage, and eye damage too is a common complication of type 1 diabetes. Foot damage is another serious complication and includes risk of severe infections that could also require foot or leg amputation. Now let's move on to the complications that come along with type 2 diabetes. Hypoglycemia and retinopathy are common complications of type 2 diabetes and can even lead to loss of vision, confusion, and anxiety. Neuropathy, kidney disease that results in dialysis or even kidney transplant are other complications of type 2 diabetes. With gestational diabetes, the complications include severe breathing difficulties, where even the newborn babies have the risk of respiratory distress syndrome. That's not all. Hypoglycemia, which can cause seizures in the baby, high blood pressure, and preeclampsia, which is a serious complication and can put the lives of both mother and baby at risk, are observed with this type of diabetes. Diabetes during pregnancy can also prove to be extremely harmful and risky. It could cause the babies to grow large and wedge in the birth canal or become prone to birth-related injuries. Even the increased blood glucose levels spike the chances of early labor, and if left untreated, severe diabetes in pregnancy may also cause the baby to be stillborn or die just after birth. You might also have a higher chance of having a cesarean section. Apart from these complications, you'll also notice various foot problems caused due to diabetes, like fungal infections, ulcers, corns, calluses, and warts. These complications may be allied with the following. Skin and bone infections are something you need to pay attention to with diabetes. Ignoring even a small cut on the foot could lead to infections, and if left untreated, it could seriously compromise your immune system and damage your blood or nerve vessels. Sometimes the infection could also penetrate the bone or the tissue and lead to a pocket of pus called an abscess. Sounds painful, right? There's also a risk of developing deformities due to damaged nerves as they weaken the feet muscles. This leads to problems such as claw feet, hammer toes, and prominent metatarsal heads. Damage to the nerves and blood vessels due to diabetes reduces your sensation and could be the reason for your foot injury or infection to go unnoticed. But if it reaches to the point of abscess or gangrene and is still not taken care of, then it could lead to amputation, even if your skin is at receiving end of diabetes complications. So, let's look at some of the most common skin diabetes complications. You'll notice yellow, reddish, or brown patches forming on the skin and a shiny porcelain-like appearance surrounding these patches. Your blood vessels become visible and you develop itchy and painful skin. Diabetes also causes certain parts of your body, like the neck, armpits, and the groin, to develop dark patches of velvety skin, also known as acanthosis nigricans. With diabetes also comes the risk of developing a condition called as digital sclerosis, which causes hardened and thickened skin to form on the fingers and the toe first. It could later spread onto the forearms, upper arms, back, shoulders, neck, face, and chest area, and in rare cases even on the knees, ankles, and the elbows. Blisters can be rare but still affect some people with diabetes, where you notice sudden appearance of painless blisters on your skin, usually on your hands, feet, legs, and forearms. Skin infections are also an unfortunate consequence for a person with diabetes, and you could experience painful swollen skin, itchy rash, tiny blisters, dry scale skin, and white discharge in any part of the body, even the scalp or around the nails. Outbreak of various colored bumps could form on the body. You'll notice yellowish scaly patches on and around the eyes that will disappear once your diabetes is properly controlled. Skin tags are also a common skin complication of diabetes. Skin tags means having skin growths that you will find hanging from a stalk, and they're generally not harmful. But if you notice a lot of these, then it may be an indicator of excessive insulin in your blood. You'll mostly find these skin tags on the eyelids, the necks, the armpit, and groin. That might have felt like a lot, but don't you worry. I've got some great ways to share that will help you to avoid and prevent such diabetes-related complications. Firstly, I'd suggest you choose your carbs carefully and eat the right amount of it every single one of the meals. If you feel the need to lose weight, then do it. It will help you reduce your blood pressure. Make sure you get your beauty sleep each night and move your body every day to stay fit and active. Trust me, it makes a huge difference. You should also be monitoring your blood sugar levels regularly, and managing your stress is the best way possible. Cut down on your consumption of junk food and reduce the salt intake too. You'll thank yourself later. Lastly, quit smoking, take care of your heart, and maintain regular communication with your doctor and your personal coach for the tests and checkups. And if you have any other questions, then don't forget to comment below and I'll be sure to address them. Also, please subscribe to our channel.